So a great question is, can I have RLE surgery after having had LASIK or PRK or SMILE surgery or one of the um, uh, surgeries that change the shape of your cornea to get you out of glasses? And the answer is simply yes. RLE surgery will take into account that you've had LASIK, PRK, RK, whatever procedure you chose to do. Certainly it may limit you to the type of lens that we can use without causing you too much risk. So for example, if you've had RK surgery, these are cuts in a radial pattern like the spokes of a bicycle wheel. This was done predominantly in the 80s, maybe the early 90s or so, and then nobody did it after that. But they cause scars, and they'll cause like a ghosting or a distortion to your vision. And then, certain times of the day, your vision might be clearer than other times of the day. So for these types of patients with RK, we would suggest using an extended depth of focus lens and never a multifocal ringed lens, because the radial cuts on the RK eye will mess with the diffractive rings and just generate a lot of uncertainty in the visual outcome. But the more common surgery is going to be LASIK and PRK. And in these cases, yes, the cornea has changed, but you've liked the surgery, hopefully, and for many years you were comfortable with the results. Now, any LASIK or PRK is going to degrade the contrast sensitivity of your visual system by a smidge. But nowadays, our multifocal lenses are just so high in contrast sensitivity that it can absorb whatever loss you have. And also just by removing the lens inside the eye, that also degrades contrast sensitivity, especially if there's any hint of cataract inside the lens, that we're going to come out with a net positive of contrast sensitivity. So I wouldn't worry about having had LASIK surgery. Now, the consideration for LASIK surgeries, we have to know what kind of LASIK surgery you had. By that I mean, if you were nearsighted before LASIK or if you were farsighted before LASIK. That matters because it tells us the general shape of your cornea, and our machines need that information accurately in order to best predict the power of the lens that can fit your eye. Now, despite best efforts, if you had any of these prior refractive surgeries, the chance is going to be a smidge higher of being off target. And that means, to the best of our technology, even with my state-of-the-art Argos or IOL Master, biometers that take all of this into account, we could still be slightly off target in the end result, because when you've had the surface of your cornea changed, the cornea no longer follows the rule that the anterior surface and the posterior surface are a parallelogram or follow each other. Now the surface may be a certain a certain curvature, and the back surface or the posterior cornea, which is unchanged, may or may not follow that anterior surface. So a lot of that is going to be caught with the measurement itself, but the nomograms that we use to further produce better accuracy in some situations and in some surgeries may not produce fully accurate predictions of the lenses. So in one of the previous videos that you may have heard, that talks about what happens if I'm off target and I end up with a little bit more glasses prescription and my vision is just suboptimal. Well, the simple answer to that is very easy to fix, but you have to give it time. Give it 3 months for the effective lens position to fully stabilize, and then we take the measurement or the refraction of the eye at that point that is stable, and then we can remove the lens and then put in the new lens to take into account all that residual refraction, such that we find the best fitting lens ultimately for your eye, and replace the one that was off target. And again, simple procedure to do takes about 5 to 10 minutes. So if we're off target, we offer that to you absolutely for free. And yeah, so don't worry about that. The headache is just the first 3 months. We'll get you through those first 3 months with contact lenses. But again, these are situations that do come up, but they're not very prevalent. I would say less than about 4% of patients are off target. So 1 in 20 or so. Those are pretty good odds. But if you're that one patient, we just ask that you be patient with us, that you trust that we will get you there ultimately, and that it will be an extra surgery, but it's a very safe one, and we can probably, we should be able to get you there within 3 to 4 months after the first surgery. So, thank you very much.